after they've had their baby, what can moms expect the first few days when it comes to their milk supply?
So naturally, all babies are sleepy the first 24 hours, whether you had a vaginal delivery, C-section, a very rapid delivery, it was a long induction. All babies are sleepy. They're just adjusting to life outside of the uterus. Okay. So in the beginning, you're just going to have what's called colostrum. It's very thick and sticky. It's made that way purposely to help coat the intestinal lining to prevent the babies from being exposed to any type of bacteria. It helps coat it so that way, as they are eating, they don't have any type of GI issues. So very helpful. So you have that colostrum the first couple of days. Around day 2, day 3, your milk starts to transition, what we call transitional milk. So it's the colostrum and the mature milk coming together. So one is leaving, the other one is coming in. Breast might start to feel a little bit heavier, start to have some changes. And then usually by day 5 is when we call your milk is in per se. Your breasts are going to be full, possibly leaking, definitely heavier, and you're getting more quantity. You're going to hear gulping from the baby. You should go through those changes. Now, if something happens, you have a 3-day induction, you ended up having to have a C-section, or you hemorrhaged, any of those things, you're going to be more likely somebody who has delayed lactogenesis, where the milk is more delayed than somebody who came in and had a pretty easy labor and delivered, because your body has to take care of you first before it can do extra like making milk. So if you're struggling, you've lost a lot of blood, your hemoglobin's low, your blood pressure is low, your body is not worried about making breast milk at that point. Okay, your body's, okay, I got to take care of you first. Okay, so all of that can kind of also play a part as far as the process of milk production. But ideally, we have that colostrum, and you can actually have colostrum during pregnancy. Our body makes prolactin, which is your milk making hormone, but it has to be triggered and told to make milk. But you can actually have it during pregnancy, especially 3rd trimester, as your hormone levels start to change in anticipation for delivery. And then that transitional milk, so you're going to start to see some color changes of the milk, and then a little bit more as far as quantity goes. And then definitely by day 5 is what we're looking for. By day 5, you are having no changes. The breasts aren't feeling any heavier. They're not feeling fuller. You're not seeing any more quantity. You're definitely going to see that in the baby, because the baby is going to be hungry, and their urine and their stool output is going to be less. So if you're kind of getting to that point, baby's losing weight, they're jaundiced, you're not seeing changes, you want to make sure that you reach out to somebody. There's some reason that your body has not been able to get your milk to come in per se. So we want to make sure that you're reaching out to somebody for assistance.
And then when it comes to the difference between colostrum and mature breast milk, and you kind of touched on that too, is that something that, is going to be very not on schedule, but on pretty much the same for everyone? Or is it kind of different when it transitions to that mature milk? And how can you kind of tell?
Moms who have produced milk before, typically it comes in sooner. Your body already knows how to do it. As soon as that stimulation, those hormone levels change, it kind of already activates it, because it stays dormant in your system until it's told to be activated. But if it's already been activated once, it kind of typically comes in sooner with multiple children than it is for a first-time mom. As long as the baby's feeding and you haven't had any major medical issues from delivery, it naturally will go through that process. So, like I say, you have colostrum like days 1 through 3. Transitional milk is around day 3. Colostrum is going to be more of a yellow consistency. You're not going to see a lot of quantity. Baby's tummy, the first couple of days is about the size of a gumball or a marble. It's very small. So they don't need huge quantities, which is perfect, because that's about all that your body's making. Around day 3, as it starts to transition, you're going to see some of that yellow kind of starting to turn a little bit more of a white color, but it'll also have a halo of clear. Okay. So that it'll start to look more of like a watery substance. That's the transitional milk. You're going to start to also feel necessarily not, I put my hands around my breast and they feel heavier, but you're going to start to feel changes kind of like against your chest, like where your clavicle and your breastbones are. They just kind of start to feel heavier, fuller, achier there, because back there is where the actual milk is produced, in the lobules and the glandular tissue back there. So you're going to start to see some of those changes. And then really when your milk comes in, it really is very instantaneous. I used to say it's like the UPS guy came and dropped it off while you were sleeping. Now I use Amazon. So it's like the Amazon guy drove up at your door and dropped it off while you were taking a nap. So literally you could lay down and take a nap and wake up and your breast be super full, really big, like you had a breast augmentation, and right there they are. They're very predominant. Definitely you're leaking milk. It's not usually this overtime long transition to when your milk comes in. Going back to what you were saying as far as, if my milk doesn't come in, because I wanted to touch base on that really quickly, is you're going to definitely, as each day the baby gets older, their tummy grows. So if you're going to notice day 3, day 4, if you're not having any changes, you're going to have a really fussy baby that's crying and just wanting to eat very frequently. Or you're going to have the opposite, a very lethargic baby. So a baby who is not getting any nutrition. So therefore it's struggling just to maintain life. So it can actually be both sides of the spectrum. A very sleepy baby that's very hard to wake up and get to feed, or a baby that's just fussy and crying all the time, that's telling you I'm not getting enough nutrition. So a couple of the big things that we look for as lactation consultants, we want to make sure that they don't lose too much weight. Naturally, they're going to lose weight because they're diuresing the amniotic fluid, just like mom does. So they're going to lose weight, but we don't want them to lose more than 10% of their birth weight within the first week of life. So losing weight is normal, just within that range. We want to make sure they're having wet and dirty diapers. The wet diaper lets me know how well hydrated a baby is. Just like us, if we are not feeling well and we're sleeping all day, we're not drinking, we might only go to the bathroom once or twice a day. It's going to be very concentrated, kind of have a little bit of odor to it. Same things with baby. If they're dehydrated, they're not going to be having those wet diapers. They won't be saturated, and they'll usually have a darker color to them, and they'll have more of an ammonia smell. Okay. Poops, all babies poop very differently. So it's so hard to determine poop as far as nutrition the first couple of days, but the poop is really beneficial because we want to make sure that they're stooling, because that helps decrease their risk of jaundice, because they're getting all that meconium out of their system. So we want to make sure that we're monitoring their weight, their pees and poops. They should have one wet and one dirty diaper for however many days old they are. They're content between feedings, and their jaundice level stays within a normal range. That's what we look at in the medical profession the first couple of days to determine, are they getting enough from mom? Okay. And if they start to fall off of the track with any of those, okay, then we start thinking, okay, what else in the puzzle is going wrong that we've got to try to fix? So as moms, it's funny how kind of those motherly instincts do kick in. And I mean, if your baby's constantly feeding, you're not having those wet diapers, definitely reach out to somebody. And you should be seeing the pediatrician within the first day or 2 days after coming home from the hospital. So the good thing is you're following up with somebody pretty quickly. So that way we're getting those interventions met quicker if we need to.